you're on speaker.
So let me first make sure, who is the power of attorney?
My mother.
Okay, so I'm mainly talking to you, huh, ma'am?
Okay.
Okay.
You kind of have to speak up because
She's kind of deaf.
Okay. So Mr. Cade, you know, he has a chronic lymphocytic leukemia, that is chronic condition, and he also has other comorbidities like obesity. And recently he was admitted to the hospital because of sepsis, which is a kind of a severe infection, likely secondary to the urinary tract infection. So we have evidence of that. So he has dirty urine, so that might be causing the severe infection of this situation. So he was treated with antibiotics, and also he's pretty weak. I'm not quite sure how functional he was before admission, but based on his age, 80 years old, and he looked pretty weak and frail after we saw him in the hospital. So after we started treatment with the antibiotics, he was a little bit improved, and we were considering to send him to a rehab place, the acute skilled nursing unit. We talked about this yesterday to you and your daughter, right? Okay.
Oh, okay.
So the plan was to send him to the skilled nursing unit to continue the antibiotic treatment and also get him a little bit stronger by having them with the physical therapy. But last night he was having acute deterioration of his condition, which is represented by the difficulty breathing, and also blood pressure was pretty low. That was around 70s or 60s. That was pretty low. That's called shock, hypotensive shock. And so we didn't know at that time what was the cause, but anyway, we treated that with by giving him IV fluid to increase the blood pressure, and also giving him breathing treatment with BiPAP, and he didn't really respond very well to that treatment. So we transferred the patient to the ICU and intubated him. That means put the tube down his throat and attach him to the breathing machine for him to be helped with that machine. So it seems that the breathing is getting a little better. We got him a little bit sedation with Versed, but later on we didn't continue that. As earlier when I examined him, I talked to him, and he followed my commands by squeezing my fingers and answered some questions if he had pain on the tummy or not. So that means he's awake, alert, and following commands. So that is a good sign that probably we can consider to lower the oxygen requirement from the machine that providing the breathing for him, and then gradually wean him off the oxygen and then extubate him. That means pull out the tube. But at this time, he is having severe respiratory failure, caused likely by the heart attack. Because, you know,
He had a heart attack?
yeah, let me continue that.
Oh,
Yesterday
okay.
evening we didn't know what was the cause for that. But this morning we monitored his cardiac enzyme, the heart enzyme. It is elevated at this time. So it is possible that he had a heart attack that caused him to having a breathing difficulty last night.
Oh.
So the first diagnosis now is acute respiratory failure, and second one is heart attack.
No, me.
So heart attack might cause the respiratory failure. So now, even though the respiratory condition is getting better, but the heart attack needs to be treated.
Oh, okay.
So we just noticed, because we follow that lab every 8 hours. So when last night the thing happened, it was checked and it was 0.02. That was within normal range. You know, it is not immediately increase of the heart enzyme after the heart attack, but over time it will increase if it is a heart attack.
Okay.
So we're going to start the treatment, and also we're going to involve the cardiology service to see if they can help further with the treatment. Okay? So his condition, you know, he has a sepsis, urinary tract infection, and chronic lymphocytic leukemia, and he has deconditioning. You know, this is a chronic condition, and also on top of that, he has acute respiratory failure, and he has very likely a heart attack at this time. So based on all of these conditions, I would like you to have a clear picture of his condition, which is very critical. Even though we try everything now, trying to give the appropriate therapy, it is very likely that his condition will deteriorate. But it also has possibility that he can get better to his base level after the treatment. For a patient with 80 years old with these many conditions, there's an option for the family to think if you want him to be full coat, which means whatever happens, you want the doctors to go ahead to do the chest compression and put the chest tube in and like do whatever needed.
Extreme
Like,
life-saving measures.
Yeah, like a 20-year-old, or you want him to have more comfort care without having those kind of suffering. To be honest, this is something that the chest compression intubation is not a very mild procedure. You know, even with those kind of procedures, for some acute things like choking, we can remove the foreign body, then everything is cleared and he can be better. But for a patient with this condition, it is really something we need to